What is AVN and what are the parts of the body affected with AVN, sir?
Very good topic, especially after the COVID pandemic. We have seen a lot increase in the number of cases of AVN in our day-to-day practice. Before we used to get like 2-3 cases in 6 months time, but nowadays it has come up to like every month we get 2 to 3 cases.
Yeah.
So what people have to understand is AVN. It's like it is avascular necrosis of the bone. To put it in simple terms, just like how you have a heart attack, the heart muscle dies because of lack of blood supply. That is called as a heart attack. Similarly, for the bone is also made up of living cells which needs nutrition via the blood supply. So when there is a disruption of the blood supply, it can lead to the damage or death of the bone cells, which is called as avascular necrosis of the bone. There are few other terms also for AVN, that is like ischemic necrosis of the bone or simply osteonecrosis of the bone. So all these terminologies mean towards the same thing, that is your bone cells are dying due to lack of blood supply.
So, what are all the causes of AVN, sir?
Causes, previously what used to be the most important cause is injury, that is like any fracture or dislocation which can affect the blood supply leads to avascular necrosis of that particular bone. That used to be the most common causes previously, but now the common causes have changed. First is like chronic alcohol usage, chronic smoking, and especially after the COVID pandemic, it is because of chronic steroids intake.
Okay.
Steroids, especially after COVID, it has become an indispensable drug. We can save the patient only with giving a lot of steroids, but just like everyone knows, steroids has side effects also. If we are using steroids for a long period of time, it can affect the blood supply of the bones, leading to AVN. There are other generalized causes like systemic disorders like diabetes mellitus, rheumatoid arthritis patients, or gout patients, and also especially among cancer treatment patients, like patients who are undergoing radiotherapy or chemotherapy, they're more prone to develop this avascular necrosis.
Okay, sir. What are all the common bones affected in avascular necrosis?
The most common bone is our thigh bone, or in other words, like the femur bone. Even in the femur, the proximal part, which forms the hip joint, becomes the most commonly affected. The next in the order is the distal femur. Next is humerus bone, and these days we are frequently seeing other bones like wrist joint bones, ankle bones, even the hand bones undergoing avascular necrosis.
So, what is the common age group with people affecting?
There is, particularly for AVN, there is no definition of like a particular age group, but most of the people whom we see in our practice fall under some 30s to 50s age group. That is the common population whom we usually encounter.
So, what are all the signs and symptoms people encounter with the AVN?
The AVN, what we have to understand is, it is like diagnosed in terms of stages. The FICET and RLET is the most commonly used staging system. To put it in simple words, there are 4 stages, starting from early signs to very severe stages. What people and everyone should understand is like how to pick it up at the early stage. So in symptoms wise, the patient usually will have a vague pain in the particular affected bone. For example, let's discuss about the femur bone, which is the most commonly affected. The patient will start having pain in their bone even when they are lying down. Initially, it might start only if they are walking, and then it can come that even when they're taking rest, there will be pain in that. Then gradually, once the femur, the proximal part is affected, the formation of the hip joint also gets affected. When the joint gets involved, you start having other symptoms like the range of movements of your hip joint becomes painful, and your the most first sign which we encounter is the rotational movements of your hip joint. That is not like when you're flexing and extending. That is when you're trying to turn your leg inside and outside. If you are having a vague pain, that becomes the first danger sign which you should be aware of. As the disease progresses, degeneration starts appearing, and you will have complete restriction of movements and complete pain even on standing or any activity.
So, what are all the diagnostic criteria for AVNs?
The diagnostic modalities is first and foremost is always the clinical examination, which will give us some clues, not entirely. Next is the X-ray, but X-ray changes can be picked up only by an experienced individual. It is not very easy because all the X-rays do not have the same clarity as we know. But the best and the gold standard always remains as MRI.
Okay, sir. What are the treatment available for AVN, sir?
So like I mentioned earlier, first is like what stage the patient comes to us. So as I mentioned earlier, there is like 4 stages. So if the patient comes in the initial stage and we are lucky enough to pick it up at that age, we can prevent the risk factors, whatever it is. For example, if they are taking some chronic drugs, we can ask them to stop, decrease your alcohol intake, or decrease the smoking. And if they're having other systemic disorders, those can be managed in a better way. Particularly in stage 1, they do better with just like normal NSAIDs and some physical therapy. But as the stage increases, the treatment also varies. For stage 2 of AVN, if you are able to catch them at that stage, still it is very much better. We can do something called as core decompression. That is a very minor procedure where it takes just 25 to 30 minutes, where we just drill holes in the proximal part to relieve the compression that is happening because of all the venous congestion, because of lack of blood supply. And recently what happens is, owing to the increase in the use of stem cells, this has become the major technological advances which we have got recently. We can inject something called as BMAC, that is bone marrow aspirate concentrate. That is, we take blood from your bone marrow, concentrate it, extract the stem cells, and inject it along the holes. And that will, what it will do is, it will reformation of the blood vessels so that the blood supply can once again be formed. So that can be done in stage 2 and stage 3. But if the patient comes to us at a very late stage, for example, stage 4, where the entire joint is destroyed, so then we have no other option left but to do for a total hip replacement surgery.
So, sir, as you said, stem cell therapy is one of the treatment for AVN. Please give us detailed information about what is stem cell therapy. As you said, it is about producing new cells. So, how long will it take to cure the affected place, and how much it is useful for the patient, sir?
Stem cell therapy has been in discussion for a long period of time, but only recently in India it has become more of a practical modality rather than just a research modality. And I am lucky enough to be one of the first few fellows studying under the Indian Stem Cell Study Group, where we frequently get trained in using this procedure as well. So in stem cells, what we try to do is, basically, as you age, we all know that there's a stem cell bank happening these days, where right after birth they isolate our umbilical cord or Wharton's jelly to preserve the stem cells. But the applications of stem cells are huge. Yeah. So similarly, the stem cells can be used for this AVN also. What is the process is that we first try to harvest the stem cells from our own blood. So since like the stem cell bank has come only recently, for previous generation people, we don't have any banks of our own stem cells.
Yes, sir.
So right now what we have left with, we are only left with taking our blood at that point. The most common source of blood is the bone marrow, which is where the blood gets formed. So we can start generating the stem cells from that. It's a process. Once the stem cells are accumulated, we can inject them directly to that procedure which I mentioned earlier called as core decompression. And the success rate of this procedure, previously without using stem cells, only core decompression, the success rate was around 50 to 60%. But with the advent of the stem cells and other orthobiologics, the success rate has gone up to 90%. But what the patient has to remember is there a cure for this? No. Till now, sadly, nowhere in the world has anyone given a 100% cure for AVN. But if we pick it up at an earlier stage, definitely the progression can be controlled for long periods of time. I would not say just 1 year, 2 years. Even for 20, 30 years, the progression can be controlled.
Okay,
That is the major advantage of using stem cells. And very few centers are using it, and very few trained professionals are also there to be able to use it at the correct amount and the correct time.
Sir, what if the patient has gone to the final end stage of AVN and they have done hip replacement also? So, what are all the physical activities they can indulge into or they can get restricted to, sir, after hip replacement surgery?
So once the patient has undergone a full total hip replacement, I'm sure all of you have heard about a tennis player called Andy Murray.
Okay.
Andy Murray was once ranked number 1 in the tennis players list, and he had undergone a hip resurfacing. That is like a partial hip replacement, and the best is he's currently playing tennis again. If that person can play tennis at a professional level, then there is no extent, there is no limit actually to what our people can achieve as well. But in India, the implants ranges vary as per the cost. So affordable implants will give you slightly restricted range of movements, but as the implants quality and everything changes, if you go for more imported implants, there is no limit to what you can do and cannot do. You can go back to your full previous activities like before.
Okay, sir.
But the only thing, key point which we have to note is that if the final stage has occurred at a very young age, for example, 30, 35, any lifetime, that is like life expectancy of an implant would be close to around 25 to 30 years. So if one patient had undergone surgery at a very early stage, that happens very rarely. We might have to do a revision surgery
Okay,
to
sir.
give him back, because that implant would have been worn out because of the
Okay.
usage.
Okay.
Where at 60, when he becomes 60, we'll have to do a revision surgery and do another hip replacement to bring him back to his normal life.
Okay.
So there's actually no limit to which, with the present technologies, with which what we can do for the patients.
Thank you for spending your valuable time. I hope this video makes so much awareness among people, and I would like to tell them to share this video to everyone among them, sir, so that they can be benefited and they can prevent it in the earlier stage, or they can come into the seek to medical attention. So thank you so much for bringing this video, sir. Thank you.
Thank you so much from my side, for your team and the entire the Lemoy team for giving me this opportunity, so that we can create awareness among the people.
Yes, yes, sir.
If they need further clarification, they can come meet me personally.
Yes,
I'm
sir.
always available to the public at Pollachi Prabhu Hospital. So many more lectures, many more interesting topics are also there. We can discuss more.
Yes, sir. Thank
Thank
you
you
so
so
much,
much.
sir. We are looking forward for many more topics. Thank you, sir.
Thank you so much.